But I want to talk particularly about some of the complications associated with these surgeries. The liver resection, actual removal of part of the liver, is a fairly complex procedure. It is done obviously in the hospital, in the operating rooms, and the surgeries can take anywhere from a few hours if it's a very simple liver resection, up to 5 or 6 hours if it's a more complicated liver resection, or if there are multiple tumors and we have to remove different areas of the liver. Generally, after surgery, patients will go to either the intensive care unit overnight or a step-down unit for close monitoring. The big complications after liver surgery are basically broken down into those which occur in the first few days after surgery and those which can occur in a more delayed manner. Generally, the liver is a very vascular organ. There are a lot of blood vessels going through it, and the early complications would be those associated with bleeding, and more later complications might be associated with infection or liver insufficiency. That is, the liver not regenerating fast enough, and the patients may get jaundice or get some swelling. So the early complications of bleeding are generally within the first 24 hours. We most often do not have to give blood transfusions for patients who have liver surgery, but we are prepared to do so in the event that it is necessary, especially with larger, more complex tumors. We do everything we can to try to decrease the risk of bleeding. Fortunately, it's a fairly rare event, but we do monitor closely for that. The later complications, such as infection, more are associated with leaks from the cut part of the liver. As you know, the liver is a very vascular organ, but it also makes yellow bile. And so in this example, this is a case of where there's a tumor on the right side, and we're going to do what's called a right liver resection. So in that particular case, we're removing the right lobe of the liver, and the bile ducts that are coming into the liver and go through the liver, there's a cut edge here. And if you get a leaking of bile from the cut edge of the liver, it can accumulate and you can get a fluid collection that's called a biloma. A biloma is essentially yellow bile fluid, and that can cause some discomfort, some loss of appetite, fever. If these bilomas are sterile, that is, there's no bacteria or infection associated with them, they resolve very quickly by having the radiologist, under either ultrasound or CT guidance, put a small drain in, called a pigtail drain, with holes in it, and the fluid comes out through the drain into a little bulb on your side, and then this fluid collection resolves. That drain stays in for anywhere from a few days to a week or so, and then this fluid collection goes away. Now, if it's infected, meaning that you have this collection here and there's bacteria in it, then the treatment would be the same, but we would put you on antibiotics. You may be on a course of antibiotics for 7 to 10 days, and we'll leave the drain in longer. You will likely go home with the drain. So that fortunately doesn't happen that often. I would say 10 or 15% of the time we might have a fluid collection, and about half of those are infected and half of those aren't infected, but that will clearly extend the hospital stay. Generally, after liver resection, we would try to get our patients out within about 4 to 5 days. For a major resection, 2 to 3 days for a more minor resection, but the hospital stay may be extended to a week or more if there's any fluid collections or infection associated with the surgery. Again, you can also, we did talk a little bit about bleeding, and again, the liver is a very vascular organ, so we try everything we can do to try to prevent any bleeding. We may use, generally will use staples to come across the large vessels, and those are titanium, little titanium clips, so they will not go off in a radar or a detector at the airport or at the border. And we will also use either microwave or radiofrequency ablation to seal the vessels along the cut edge of the liver. And then what will happen is after the surgery, the liver will regenerate. Generally, that will take a few days to start working, but may take 6, 8 to 10 weeks or more for the liver to completely regenerate. We follow the liver regeneration with blood tests. We check the clotting factors, we check the bilirubin level, and we'll go over those with you every day after your surgery and give you an update on how well your liver is regenerating. Liver resection generally has a hospital stay anywhere from 3 to 4 days if it's a fairly uncomplicated procedure. If it's done laparoscopically, maybe as little as 2 to 3 days for a straightforward, less complex procedure, up to 5 to 7 days if it's a more complicated major resection where you're removing a lobe or more. Again, these can be done both laparoscopically and open. It really depends on the size, number of tumors, and the location of the tumors, and we'll go over that in more detail when we speak individually. The recovery period in the hospital is generally 1 day in the step down or intensive care. The rest of the stay will be on the hospital ward. When you go home, we'll be encouraging you to be up and around, walking. You can do the stairs, anything that gets you moving and mobile, deep breathing are all encouraged after a liver resection. We also will be feeding you very quickly after surgery. There may be a tube in your nose overnight, but we'll start clear liquids generally the next day and advance to a regular diet over a couple of days. The type of foods, we'll have a nutritionist see you in the hospital and go over that. But really for liver resections, because it does not involve the GI tract, we're not actually removing any intestine, we try to get patients back to eating fairly regular food within a couple of days. After your liver surgery, because the liver has such an important physiologic function, because it is so important in your protein balance, in blood coagulation, in processing bile, some of the things that we see after liver surgery are unique to liver surgery. For example, patients tend to put on a lot of water weight after major liver surgery, so you will notice your feet are puffy, your fingers and face may be puffy, and as soon as we notice that, we will definitely do everything we can to try to get rid of that extra fluid. Getting up and around certainly helps, but you may be getting a diuretic, which is a medicine such as Lasix to help get rid of that extra water. You may notice if we do a major liver resection that your urine is dark, or you may have a little bit of jaundice, and that just tells us that the liver has to regenerate. That may last for a few days up to a few weeks after surgery. Generally, for these surgeries, we try not to give any blood products, either plasma or blood, but occasionally if somebody, especially if they're anemic or it's a very complex surgery, that possibility always exists. But most of our patients are not having to get blood products with their liver surgery.